I'm very excited to present to you a study entitled Impressive Treatment Success and Safety of Dolutegravir seen among adolescents living with HIV treated at BIPAI clinics across 6 countries in Eastern and Southern Africa. As we know, early trial data of DTG use amongst children and adolescents has been very encouraging and promising. However, no large-scale programmatic data of DTG use amongst adolescents in Eastern and Southern Africa yet exists. Therefore, we looked at DTG use and data across the BIPAI Network Center of Excellence in 6 sub-Saharan African countries to examine its efficacy and safety. For our methodology, we did a retrospective review between 2017 and 2020 at the 7 sites across the 6 countries seen in the map. We defined HIV viral load suppression as a viral load less than 1,000 copies. Our cohort consisted of adolescents aged 10 to 19-year-old who were given DTG as part of their care. And we also examined single drug substitution where the NNRTI backbone remained the same and the only shift was using DTG. For our results, our cohort consisted of 8,091 adolescents who received DTG during the study period. This was 61% of all adolescents in care during that time. And the figure on the lower left, you can see that TLD was the most commonly used formulation. The center graph shows the breakdown across country, and then the right graph shows the even split between sexes and between 2 age groups, 10 to 14 and 15 to 19. Here's a quick snapshot of the baseline characteristics of this cohort. Of note, they were ART experienced for the most part, with an average time on ART of 8.8 years, and only 4% were new ART initiations, the majority being shifted from NNRTI regimens. We also had a good follow-up period of 350 days post-DTG for our cohort. Regarding our outcomes, the upper left shows that DTG was very well tolerated amongst this cohort. There were only 26 patients who had adverse drug reactions requiring discontinuation. We also had good follow-up with 95% remaining in care and only 1.4% being lost to follow-up, an N of 98, or dying, an N of 17. The right side shows the good suppression rates. We had pre and post DTG change with no significant drop. And even amongst those new ART initiations with DTG, there was 92.3% suppression rate at time of study censure. Lastly, the lower right graph shows that 79% of patients who were previously unsuppressed were able to become suppressed, while 95% of those previously suppressed sustained their suppression on DTG. Regarding the safety, this is a closer look at those 26 patients. The good news is that 21 of them, the adverse drug reactions were grade 1 or 2 mild reactions, while only 5 of them, or a total of 0.06% of the whole cohort, had a severe grade 3 or 4 toxicity requiring discontinuation. Looking at the 2 age groups, again, we found no statistically significant loss of suppression in either group, and we found really nice rates of those who were unsuppressed becoming suppressed with DTG. Regarding the single drug substitution, there was a total of 2,060 adolescents who had single drug substitution with DTG. This was 25% of the total cohort. And of note, routine HIV genotyping or pre-switch HIV resistance testing was not done and not routinely available at our sites. The figure here also shows that the majority of these single drug substitutions were using TDF or abacavir-based regimens. Amongst those who were previously suppressed, we found that single drug substitutions had excellent maintenance of the suppression with no statistically significant differences or drops, whether it was using the tenofovir or abacavir regimens. We also found large percentages of those who were previously unsuppressed got suppression using single drug substitutions. Regarding the age groups, the interesting finding is that the older adolescents did slightly worse than the younger adolescents in both maintaining suppression and slightly lower rates of becoming suppressed amongst the adolescents. Again, noticing that this is often a higher risk group and age group. So in summary, we found that dolutegravir was very well tolerated and effective amongst our cohort of adolescents. It resulted in viral suppression for many previously unsuppressed adolescents, as well as had high rates of maintaining viral suppression in those adolescents. We also found that single drug substitution was an effective option for adolescents when using dolutegravir. Our study, of course, had limitations, the lack of HIV genotype and drug resistance data. Our analysis was unable to look at psychosocial determinants of adherence. And of course, we couldn't analyze the impact that the COVID-19 pandemic might have had on this cohort during the time period. As next steps, we hope to extend follow-up to capture additional post-DTG viral loads. We also want to take a closer and more detailed look at those adolescents who are unable to suppress on a DTG regimen, and of course, have a deeper and more targeted look at those older adolescents, the 15 to 19-year-olds. I thank you very much for listening to this presentation. Here is my contact email if any questions, and a big thank you to the entire BIPAI network who assisted with data sets, presentation, and analysis. Thank you very much.